Good morning, everyone, and welcome once again to Adolescent and Youth SRHR Digital Platform. I know it's been a while, yes, getting engaged here and there, but now we are back. At least now we'll be having weekly shows where now we'll be expanding more on even matters, even adolescents and youth with regard to their reproductive health. So today we are going to look at the findings of the Kenya Demographic and Health Survey 2022 that was recently released on teenage pregnancy. So the research focused on the age group 15 to 19. All right, and according to the DHIS, it says that they are looking at percentage of women aged 15 to 19 who have ever been pregnant. All right, so I'd like to attach or display, the findings just a little bit. Of the survey, and according to the results of the survey, 15% of women aged 15 to 19 have ever been pregnant. Okay, 12% have had a live birth. Live birth meaning that even when they gave birth, the child came out. Okay, and then 1% have had a pregnancy loss, and 3% are currently pregnant. The results, the survey also further reveals that the percentage of women aged 15 to 19 who have ever been pregnant increases with age, from 3% among those aged 15 to 31% among those aged 19. So this also brings to the question. You find that at 15, the ones who are pregnant is at 3%. But when they get to 19, it increases to 31%. So now this begs the question. Aren't the initiatives that are present to curb the increase of teenage pregnancy, are they not working? Because you find that in schools, in public schools in Kenya, what is supposed to be shared with the adolescents is that there is no sex before marriage, okay? Which is good because they are supposed to have it at the appropriate time. So for these adolescents who are getting pregnant at 15, even at this particular period of time, why is there that particular increase? What can development partners do to ensure that there is a decrease with regard to the prevalence of teenage pregnancy, because you can see it is rising even with age. 15, at 15 it's at 3%. By the time it's 19, it's at 31%. So I think it is ample time that development partners and different stakeholders come together to see how we can curb this, because it is good that we adhere even to the ICPD 25 commitments, where one of them is zero, even having zero zero maternal deaths, even ending even teenage pregnancy as it is. So I think it is high time that all stakeholders come together and rethink, because you see this survey is for the entire Kenya. This is not one county. This is the entire Kenya. So more needs to be done. So it's also saying that about 4 in 10 women aged 15 to 19 who have no education have ever been pregnant, as compared with only 5% of women who have more than secondary education. So about 4 in 10 women aged 15 to 19, that means 40% who do not have education have ever been pregnant. So my interpretation is that we should invest more in the education of the girl child. Because you find that because there is a cross linkage between the education and health, more so sexual reproductive health. So therefore, the Ministry of Health, the Ministry of Education can even come together and brainstorm on even how to end this teenage prevalence, and also the Ministry of Education to see whether they can even increase the amount allocated towards bursaries to ensure that more girls are enrolled in school. The other thing that I'd also like to touch on is the finding that states that teenage women in the lowest wealth quintile are more likely to have ever been pregnant than women in the highest wealth quintile. So therefore, this means that, in a nutshell, they're saying that teenagers who come from poor families are more likely to get pregnant as compared to the ones who are from rich families. And therefore, this means that the government as a whole, there is need for ensuring that our economy improves. Because even as at the moment, you find that the rate of inflation is very high, things are very expensive, the rate of unemployment is very high. Persons living in informal settlements, you find that they don't have any job, and as a matter of fact, now they stay at home. They also stay at home with their kids, and sometimes even when they go, they leave the kids at home with no caregiver. And as such, you find that at that particular period of time, the kid gets introduced to sex by their peers, and also they also get to learn about it from different sources. And that is why it is imperative for the government to ensure that more jobs are created. because Kenyans are employed. If 80% of Kenyans are employed, that means that there'll be more income coming to each household. That means that girls are going to go to school, even boys are going to go to school, so no one will be idling. And then you'll find that even the health of even families are going to improve. But as it is at the moment, that is a challenge. And this requires now the government to rethink its intervention as it is at the moment. So the other thing I'd also like to add is they have stated that the percentage of women who have ever been pregnant decreases from 21% among those in the lowest wealth quintile to 8% among those in the in the highest wealth quintile. Just as I reiterated before, household income plays a key role in curbing teenage pregnancy. And that is why it is imperative for all stakeholders to come together so that this particular prevalence, as it is seen at the moment, can reduce drastically or even get to zero. But I believe there is hope. You know, they say that if a country has no vision, the people will perish. And that is why even the national government, through the Kenya National Bureau of Statistics, carried out this survey so that it can guide their planning moving forward. So I want to say thank you for joining us for this first show of this particular health platform, and looking forward to interacting with you further. You may also leave a comment or a question which I will answer later. So thank you, and see you next time. Asante.